Hello, my name is Jordan Bukla. I'm a doctor of nursing practice, and today I would like to discuss the different options you may have if you have either an acute or a chronic injury. At BioRestore, we offer a plethora of options when it comes to recovery. There's a lot of different hierarchies to them if you consider it price-wise. The low-hanging fruit would kind of be a peptide route. There's also radio shockwave therapy, and then even donated umbilical cord tissue for alternative regenerative medicine. Now, a few things that would help gauge which treatment option would be best for you would be the severity of your injury as well as the location. One of the most common complaints I receive as a provider is a nagging injury that just doesn't seem to heal. I would like to discuss the different options that you may have. The first one being a peptide, the most common one being BPC 157, TB 500, or even a combination of the two. The combination of the two is definitely the most popular and will give you the best bang for your buck. BPC 157 is responsible for angiogenesis, which is the creation of new blood vessels. It also increased fibroblasts to the area of injury to help with scaffolding and creating new tissue. TB 500 is a truncated version of thymosin beta 4, and it is responsible for a really large decrease in inflammatory response. So with the combination of the two, you have a speedy recovery as well as a decrease in inflammation. For musculoskeletal injuries, it's best that you inject the BPC 157, the TB 500, as a subcutaneous injection. Research doesn't really show vast improvement, whether it's a subcutaneous injection just in your stomach as opposed to a localized injection directly at the site of injury. However, I would say anecdotally, most patients receive better benefits and quicker response with a spot treatment. Another option in conjunction with BPC 157 and TB 500, or just on its own, is something called radial shockwave therapy. This uses acoustic sound waves to cause micro tears in an area of injury to promote more blood flow and recovery in that area. It almost reawakens your body to say, hey, focus on this injury here. This can help decrease scar tissue as well as increase collagen formation in areas of injury. Usually this process is about 6 sessions at the bare minimum, spaced 1 week apart. A more aggressive approach would be using alternative regenerative medicine, which would include donated umbilical cord tissue that would be sourced from an FDA-regulated as well as an American Association Tissue Bank accredited laboratory that would offer you benefits such as regeneration of possible cartilage tissue, tendon tissue, ligaments, and any type of injury that you may have in an area of a joint or systemically. 2026 is the year that your nagging injury gets put to rest. Come book a consultation with me so we can discuss which route is best for you.